So today we'll talk about or dive deep into Alzheimer's disease. Now, Alzheimer's disease is the most common type of dementia. Just a few statistics here on Alzheimer's disease. It is the sixth leading cause of death in America. It's the only cause of death in that top 10 causes of death in America that cannot be prevented, slowed, or cured. But I do want to say that there are treatments that can help manage the condition, and we'll talk more about what those treatments are, but you can live well with dementia with Alzheimer's disease. And there are also proven ways to help dramatically reduce your risk for developing Alzheimer's disease as well. About 1 in 3 seniors dies with Alzheimer's disease or another type of dementia. And right now, I mean, the numbers are, there are a little bit over 5 million Americans that are living with Alzheimer's disease. And by 2050, which is not that far away from here, barring a new medication, barring a treatment or a prevention, that number is projected to rise by 14 million. So really, Alzheimer's disease is an epidemic within itself. It attacks people that are mostly elderly. And the term elderly is considered 65 and older. So right now, 1 in 10 persons 65 and older has Alzheimer's dementia. But about of that 5 million, or a little over 5 million, about 80% of those individuals that are diagnosed are 75 years or older. And it does affect more women than it does men. It could be for a variety of reasons that women tend to live longer than men. Women are less risky than men, do less risky things, in our environment than men. It could have something to do with hormones. There's a lot of theories why it affects more women than men, but nothing that we know definitively, unfortunately. So Alzheimer's disease is a progressive neurologic disorder that does have permanent changes to the brain and chemical changes to the brain. And what happens is the cells, those neurons within the brain, they become damaged. They get attacked, they become damaged, they get destroyed, and the brain starts to atrophy inside the skull. Now, I do want to clarify Alzheimer's disease and dementia, because those words are used interchangeably quite often, but dementia is that umbrella term. And there are about 100 different types of dementia and progressive dementias. And like I said earlier, we will be talking each week, each Thursday, more about specific dementias. Alzheimer's disease is the most common type of dementia. And a lot of the research that you hear in the news and medications are for the Alzheimer's specific type of dementia. But again, there are several different types of dementia. But if you think about it, Alzheimer's disease is a brain disease. It's a type of brain disease. Just like if you were to say COPD is a type of heart disease. It is degenerative, meaning that it will get worse with time. And again, it is the most common type of dementia. So most people that have a dementia diagnosis will have an Alzheimer's diagnosis, or they'll have Alzheimer's with a different or another type of dementia as well. That's becoming more and more prevalent, and we're seeing that more and more often. Risk factors for dementia. The #1 risk factor is age. So the older we get, the more common it is that we're going to develop Alzheimer's disease or another type of dementia. Now, I will say it's a risk factor. It doesn't mean just because we get older and we hit a certain age, we're going to get Alzheimer's disease. It's just a risk factor. Family history is also a risk factor, and that meaning if you have a parent or a sibling that have had Alzheimer's disease or has it, you're a little bit higher risk for developing the disease as well. Again, it is not deterministic. It's just a risk increase for you. And a lot of that has to do with some type of genetics. So they are learning more and more about genetics and genes that play a part into getting Alzheimer's disease. There are some gene mutations that can cause Alzheimer's disease. These mutations are extremely rare, and it might affect 200 families worldwide for this particular gene that would cause Alzheimer's disease. It's very rare, and you would know if it's in your family And there's also some studies on people that have Down syndrome. There's some genes that affect them that can really increase their risk for developing Alzheimer's disease as well. But for the majority of us, the genetic part that plays in this is there are some genes or variances of genes that can increase our risk. Just because if I have this particular variant of a gene that has been shown to increase your risk, it doesn't mean you're going to get it. Again, it's not deterministic, it's just a risk factor. It also doesn't mean that if you do not have this genetic variant that's been shown to increase your risk, it doesn't mean that you won't get Alzheimer's disease either. This is a very complex disease. And I heard a doctor say once, well, the more we learn about Alzheimer's disease, the less we know. Meaning that we learn more and more about it, the more we delve into it and the more research that's done, but also understanding how more and more complex it is. So head trauma, previous head trauma can increase your risk for Alzheimer's disease. This can be mild head trauma up to more severe head trauma. If we smoke or we drink over heavily drink usage or drugs as well, that will dramatically increase your risk for Alzheimer's disease. And also any kind of cardiovascular disease, high blood pressure, high cholesterol, obesity, anything like that will increase your risk. A lot of that has to do that our heart and our brain are directly connected. We need our heart to be working well to feed our brain. Long-term sleep disturbances have been shown as a risk factor also. And this is untreated sleep disturbances, okay, that maybe we've had a hard time throughout our lives because sleep can really affect our brain and how it works. A history of depression that has been unmanaged or untreated can increase your risk. And then there's environmental toxins and lifestyle choices. So air pollution in certain areas, there's higher risk for it. They've kind of made that correlation. Some toxins or chemicals, especially people that work around chemicals and maybe don't wear masks like they should and not protecting their brain. Of course, stress, unmanaged stress, not sleeping well is another one. If we're just not eating right, we just have a very poor nutrition, we're not exercising, limited physical, mental, and emotional health as well, but social activity they're seeing also. If we are not being proactive in making good choices in those areas of our lives, then that can really influence our brain health and influence our risk factor for developing Alzheimer's disease. Now, I will say on here, a lot of these risk factors that are listed are modifiable. A lot of them are lifestyle choices or things that I maybe need to manage a little bit better. I just realized one thing that's not on here that is a big risk factor is diabetes. So let's say I had diabetes and I wasn't managing it well or doing good treatment for it. That will increase my risk even more so for dementia. But if I have diabetes and I'm managing it well and I'm being, advocating for it and I'm doing the right treatments, that can help manage that risk. The only risk factors that really we don't have a lot of control over is age, genetics, family history, and then gender, right? And gender was that I mentioned earlier, women seem to have higher prevalence of Alzheimer's disease than men do. So this, I just want to quickly go over the common signs for Alzheimer's disease. And I have two different lists here because I like the way some of them are worded. But with Alzheimer's disease, those hallmark symptoms that we know something's not quite right is memory loss. And it's memory loss for recent events, maybe names, I just can't remember. And really a difficulty learning something new with somebody with Alzheimer's disease. They might regularly repeat themselves, right? Or you might notice there's little notes lying around all over the place to help give them reminders about things. Difficulty performing daily tasks. And these are tasks that we just kind of do every day, okay? Just those everyday things that maybe we don't even really think about. We just kind of do it, but now I'm noticing that they're having a harder time with those tasks. And a hard time with language. And this can be finding the right word, remembering people's names, following a conversation or following a storyline, having a hard time keeping up. disoriented to time or place, or getting lost often, and getting lost in familiar areas. We all can get lost in an unfamiliar area, but in these unfamiliar areas of getting lost, or just more disoriented to where I am in time, and maybe even more disoriented where I'm in place, but where I am in time as well. Poor judgment, or just a decrease in judgment from normal behavior, and problems keeping track of things. So this might be they're actually losing items more often, but also keeping track of the day, having a hard time doing that. And maybe they're misplacing things, but you're finding them in really odd places, like the remote control is in the refrigerator. And that's just kind of odd, right? And it's not a one-time thing because I'm stressed out and really distracted. You're seeing this as a theme, seeing over and over again. And then a change in mood or behavior. And this can be anything from somebody that just becomes easily agitated, which is not normal for them. Maybe they withdraw from social settings. They're not talking like they used to. They're not engaging. Or it can become worse at night. As the day goes on, they become more tired and they're just not as in control of their emotions. And then having trouble with images and spatial stuff in the, so they might look at the stop sign and it says red, but they're seeing it differently and they just go ahead and go. So these are signs and symptoms that something is wrong and we need to talk to a doctor about it. And you can see these in yourself or you can see this in a loved one, right? But these are pretty specific to Alzheimer's disease and things that you start to see first off because of the changes that are happening in the brain. With Alzheimer's, it is thought that what's happening to the brain, we'll see a video here in a second to know exactly what's happening, but it's thought to begin several years, up to even 20 years before you start to see any symptoms of the disease, any that first memory loss or putting things in odd places. So the damage that's happening to the brain over years can be happening before you start to see noticeable symptoms. These symptoms occur because of what's happening to the brain and the neurons that are being destroyed. Eventually, as the disease progresses throughout the brain, and more neurons are affected, they will eventually get a person's basic functioning, so their ability to walk, swallow, and those things. And Alzheimer's disease and other progressive neurological dementias are ultimately fatal. The rate at which Alzheimer's progresses, however, can change. On average, it's about 4 to 8 years after diagnosis, but individuals can live as long as up to 20 years. It depends on other risk factors, it depends on age, it depends on a lot of stuff. And I say you can live 48 years after diagnosis because what we continuously see is people are not getting diagnosed early enough. So you might not start seeing a doctor or start raising questions or getting some proper diagnosis until you're really further on into the disease, where it's undeniable, we got to get help here. And also the progression of the pathology of the disease is fairly predictable with Alzheimer's disease. We kind of know how it will spread throughout the brain, but how it affects a person is so individualistic. And also, I just want to say Alzheimer's disease is not something that the person caused. They didn't do one specific thing to get this disease. And it's not something they can control either. I guarantee you, somebody said, I don't want Alzheimer's disease, so I didn't cause it. So just keeping that in mind. I'm going to watch this short video on Alzheimer's in the brain. And how what's really happening inside the brain. You know what? I can't. I'm so sorry. I'm going to have to unshare and share again. I messed that up. I got to share my sound. 1 second. Okay.
In healthy people, all sensations, movements, thoughts, memories, and feelings are the result of signals that pass through billions of nerve cells or neurons in the brain. Neurons constantly communicate with each other through electrical charges that travel down axons, causing the release of chemicals across tiny gaps to neighboring neurons. Other cells in the brain, such as astrocytes and microglia, clear away debris and help keep neurons healthy. In a person with Alzheimer's disease, the most basic form of dementia, toxic changes in the brain destroy this healthy balance. These changes may occur years, even decades, before the first signs of dementia. Researchers believe that this process involves two proteins called beta amyloid and tau, which somehow become toxic to the brain. It appears that abnormal tau accumulates, eventually forming tangles inside neurons. And beta amyloid clumps into plaques, which slowly build up between neurons. As the level of amyloid reaches a tipping point, there is a rapid spread of tau throughout the brain. But tau and beta amyloid may not be the only factors involved in Alzheimer's. Other changes that affect the brain may also play a role over time. The vascular system may fail to deliver sufficient blood and nutrients to the brain. The brain may lack the glucose needed to power its activity. Chronic inflammation sets in as microglial cells fail to clear away debris, and astrocytes react to distressed microglia. Eventually, neurons lose their ability to communicate. As neurons die, the brain shrinks, beginning in the hippocampus, a part of the brain important to learning and memory. People may begin to experience memory loss, impaired decision-making, and language problems. As more neurons die throughout the brain, a person with Alzheimer's gradually loses the ability to think, remember, make decisions, and function independently.
So that is a pretty basic understanding of what's actually going on in the brain of somebody with Alzheimer's disease. It is more than just memory loss. We know it starts in a specific area of the brain and then it spreads throughout. And it affects most areas of the brain, which means it'll affect most areas of a person. To get a proper diagnosis for Alzheimer's disease and other types of dementia, is your physician probably wants to work alongside a neurologist or a geriatrician, geropsychiatrist, and neuropsychologist to make a proper diagnosis, because there's not one single test that can tell you whether you have the disease or not. It is a battery of tools, tests, and assessments that help make this diagnosis. Listed here are a few. They'll get some medical and family history, maybe some psychiatric history, but also a history of what your cognitive and behavioral, any possible cognitive or behavioral changes as well. And they'll ask the individual, but they'll also get family input as well. They'll do testing on problem solving. They'll do several cognitive tests, several neuropsychological tests as well, memory testing to see where you're at. They will do physical exams. They'll do blood tests. They're going to do some brain imaging. And what they want to do is they want to rule out any other thing that might be causing these symptoms. They want to rule out that it's not a brain tumor, or you don't have a vitamin deficiency, where it's not another disease that's causing these symptoms that can possibly be treated or managed. They can also get some other brain imaging. There's a PET scan and a lumbar puncture that can see the level of that beta amyloid or that tau within your bloodstream. And the presence of that, or the lack of presence of the beta amyloid or the tau that's in your blood, kind of would tell us whether you have it or not. Now, the definitive, or you get 100% diagnosis accuracy is at autopsy for any type of dementia, but the accuracy rate on this diagnosing for Alzheimer's disease is within 90%. And what the hard part of it is they can tell you whether you might have a neurological or progressive dementia or not. They might just not be able to tell you exactly what type, because what they are continuing to see is they might see those hallmark signs of Alzheimer's disease, but there's some other things going on as well that might be another type of dementia. So there's two types of dementia happening in the same brain. And then, of course, other factors that can cause some brain changes as well. Now, there are medications that help with this disease. There are 5 FDA-approved medications for Alzheimer's disease. These medications don't change the disease in any way, but what they do is they help alleviate the symptoms of the disease. So somebody can do better for a longer period of time. With these medications, the chance for best success is to start them as early as possible, because that's when they work the best. With these medications, though, there is a limitation on their effectiveness. So with the first 3 that are listed, I'll go with the brand name because most of us know that, Aricept, Razidine, and Exelon. These are all used for the earlier stages to middle stages of the disease. And what these do, just basic understanding, is they increase the amount of neurotransmitters in the brain. So they increase the chemicals that help those neurons work together. But these medications can only work for a period of time. So typically what will happen is Namenda, the last one listed, that is for the more middle, moderate stages to later stages of the disease. They will add that on to one of these. There is the Namenda Aricept combination medication. That's that 5th medication. FDA-approved medication is typically what happens. And if the disease progresses, you'll get put on that combination medication. Another thing is these medications may not work for every person. Side effects might be too severe. A lot of them, side effects are digestive issues. You might need to go through to try a different type of, maybe Aricept was really hard for you, but Exelon works better as far as side effects or just seeing the effects of the disease. So there can be, to find the right cocktail, I guess, for you or for your loved one. It might take a little while. It might take some trial and error to find what works best for y'all. But to know that, to work very closely with your doctors on any type of medication. In talking about non-pharmacological treatments, I think one of the best things to do when you are seeing symptoms or you're getting a diagnosis, to get on those FDA-approved medications as soon as possible. But also knowing that as the disease progresses, non-pharmacological treatments are going to be your first line for any intervention. These really help maximize independence. They improve quality of life for both the person with the diagnosis and their caregivers. They help maintain a current level of functioning in each person. So we really want to use these non-drug approaches first, outside of doing those FDA-approved medications. Several studies have shown over and over again the non-drug approaches for treatment and just managing the day with somebody with dementia are way more effective than another type of drug. We also want to make sure that we are effectively managing any other chronic illness or disease that we might have as well, because if we're not managing that, then the dementia can be worse. But if I have depression also, I want to make sure I'm treating the depression as best I can so the dementia can be better. A few things, the non-pharmacological treatments that have studies attached to them are exercise. Is showing, and there's more and more studies coming out about the benefits of exercise. So aerobic and non-aerobic exercise, a combination, has shown that it can slow cognitive decline. Now, again, it's not changing the disease. It can't stop Alzheimer's disease, but it's been showing that it can slow cognitive decline in somebody for a period of time. Also, cognitive stimulation, and this is beneficial to just the cognition, but also the whole well-being of somebody with Alzheimer's disease. It's also been shown that it can improve depression. And when I say cognitive stimulation, we're talking about validation, music, cognitive exercises, so making sure they're cognitive stimulated, maybe do some even memory training with them, just to keep that brain going, keep it working. Purposeful activities that are familiar, reminiscing, anything like that. Pet therapy, aromatherapy, music therapy, light therapy, these are all non-pharmacological treatments. Intergenerational activities, socialization, and of course this will be modified as the disease changes, but continuing to keep that socialization and those human connections. This is not an exhaustive list of non-pharmacological treatments, but it's a good start. And this is what we really want to focus on when we are treating or managing the disease. Because of time, the next couple of slides will just give you some more common characteristics of what you might see in the early stages of Alzheimer's, what it looks like to the middle stages. I will say when you get to the middle stages of Alzheimer's disease, it tends to be the longest stage of Alzheimer's disease, and you'll have more surprises, meaning the changes that you see can catch you off guard a little bit more. It's not just I don't remember, what I had for breakfast, but now it is I'm needing more help with my self-care activities. I'm more confused about where I am in time, where I am in the day, but also where I'm in space. You might notice some sleep pattern changes in those middle stages. So this is, if you haven't already, if you're a caregiver, you're going to have to get support and help because it becomes a lot more to manage in the middle stages of the disease. And of course, in the late stages of the disease, there is, all those neurons, the disease is spread throughout the brain, and they do need 24-hour care. And it's all hands-on care. So their self-care needs, they will need assistance with all of that. And they're usually not communicative at this point. But this is when you'll start to notice those changes in those basic functions, like the swallowing, the walking, and eventually can be very vulnerable to infections, especially pneumonia. I'm going to show this video. It's just 3 minutes, but it gives a good
What
summary.
is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part.
I think that's just a nice summary of what Alzheimer's disease is, and how it affects the brain, but also how it affects the family, or the person in the family and the community. So I'll just leave you with nurturing what remains in a person with Alzheimer's disease, wherever they're at in the stages. Education, continuing to get support and help, and self-care for everyone are really the keys to living well with Alzheimer's disease and related dementias. So are there any questions? I see there's a couple in chat. I will be sending out the slides, and you'll also have, I'll make sure that you have a hyperlink to both of those videos that are in the slides, so you should be able to click on them. It should take you straight to YouTube to watch both of those videos. And there was a question about the light therapy. So there's a certain light that you can get to help with sleep disturbances. So if you turn that light on, it helps the body kind of reset that circadian rhythm because it sees it as sunlight. It can also help with mood as well. Because the body is taking in that light therapy, kind of and it's metabolizing it like it's the form of vitamin D. And so it can help with that mood depression. Holly, I'm going to call on you. Do you happen to know the name of that light? Here.
Yes, the one that I just purchased, actually got it in this week, is called Happy Light, and I bought it on Amazon. There's a lot of them out there. I was just pulling it up. They sell them at Bed Bath & Beyond, but I ordered mine on Amazon and literally had it the next day. They range from anywhere from $30 to $50, and it comes with a booklet that explains how to use it because you can work your way. It mimics sunlight, but it has different settings. You can start with like 10 minutes a day and work up to an hour a day. And it is to help boost mood. A lot of people use it to have seasonal affective disorder that maybe find themselves a little more depressed in the fall and the winter. And like I said, I just got mine in. It's sitting right here beside me. I've already used it this morning, and I'm just starting with 10 minutes at a time. But the one I've got is called Happy Light.
Thank you. Does anybody have any other questions or comments?
I do. I wonder if that's why my husband likes all the lights on in the room where he is, because he's needing that light. Is that the way that works?
It could be. That could be part of it. It could also be, we do know with Alzheimer's disease, the vision changes so much, just how they're seeing the world. So the more light, the better, because it helps them see their environment. And also knowing that what they're seeing might be interpreted differently too. So especially as the sun goes down and the light might play shadows on stuff, or there's shadows or there's glares off of things, that somebody with Alzheimer's might not be seeing that as a shadow or a glare and I need to go open the blinds or close them, but it can be seen as something like that's a hole or there's a void over there, and that can, of course, if I'm seeing a void or a hole, that can be a little upsetting. So it's not a vision limitation, but it's also an interpretation issue. So the more light, the better, because it can help you actually see the environment.
Oh, is that light, that happy light that you got, Holly, is that to give them more light and you use on them in their face?
It just is something that you have sitting, like I've got mine sitting on a little end table, and it's on in the room so that it does make the room brighter. And what Jamie was saying, so many times what's happening is that there's shadows. And I've seen it happen with people where the shadow on the floor to them looks like a hole in the floor, or the shadow, even shadows that they see outside, they mistake what it is. So lots of times they do want all the lights on. The brighter, the better.
Well, we have, our family room is all windows on one wall. And I think, why does he want the lights on too?
Holly, I have a question related to that comment. Science was not my specialty in school, that's for sure. But it's my understanding that it's not just the amount of light, but it's that these lights have a different part of the light spectrum, different types of light waves. So just going out and getting 100-watt light bulb instead of a 75 isn't what we're talking about. Is that correct?
That's exactly right. As a matter of fact, I've got my little booklet here, and this particular one that I got has 5 different settings, and you can read, I mean, it's very, I mean, it can get pretty technical, and it's about light therapy, doing it in 10-minute increments, and how you work yourself up to these different levels of light, but it mimics daylight. So yes, Carolyn, you're exactly right. It's not just a difference in going and changing the wattage in your light bulbs.
And I knew a gentleman who, with the light therapy, he would set his mother in front of the light every morning. And part of it was to help with her mood, but a lot of it was also to help her, her body to recognize that it's morning. So it helped reset her sleep-wake clock, her internal sleep-wake cycle. Since he did that and set her in front of it, right in front of that light, for however long every morning. And that
Here's
was
mine.
Oh,
so small.
Yeah, that's what it looks like. But boy, it can really put off some light. Like I said, it's got 5 settings, and on the back down here on the bottom, you set it in 10-minute increments. Mine is made by Verilux, Verilux, Happy Light. And I did a lot of research on them and went through, I was looking through them on like a prevention magazine. See, it says Happy Light. They've got all different sizes. I just wanted one that was more like a desktop. So that's the one I got.
So is it for a therapy type? It's a therapy, right?
Yep, it's light therapy.
And does it have, is it a calming effect or?
Yeah, and the people that I've known that have used them before swear by them. I worked with somebody still who uses it. She ended up buying one for her home and for her office because she said she just feels better, and that she realizes when she doesn't use it. So I got to reading the research on it and thought it's worth a try.
So you can set it for 10 minutes and it'll go on and then go off by itself?
Yep, turns off by itself.
Interesting.
And it works.
And he can't get still. He can't get everything around him straightened up, you know. He wants everything organized, and I watch him and he moves objects around and he's just busy all the time. Makes you tired watching him. So I wonder if that would help that.
It might. Yeah. Might be worth a try.
Yeah. Okay.
Thank you. Are there any other questions or comments? Well, we'll be sending out the slides, a recording of the video, and make sure you get the link to the 2 videos in the slide. But we appreciate you being here. I will also send information on the upcoming support groups. And then next week, we will be talking about vascular dementia in depth at 11 o'clock. So make sure you get that detailed information with the links to register. We appreciate you so much. Thank you.
Thank you. Bye-bye. Thanks.
Bye, everybody.